All right, good afternoon, everybody. Once again, this is Andrew Cole with East Orlando Chamber of Commerce, and we've got another great webinar for you today. We have Dr. Syed with AdventHealth and going to be presenting on managing stress in a positive way. We've gone through a lot of different pieces here through COVID-19 and how to navigate that and how to reduce those stress factors that we have. But before, as I always do, I want to make sure that we're recognizing those that helped put this on today. And with that, I want to thank PowerNet. PowerNet is powering this webinar today for us. We appreciate the partnership that we have created with them, and they have great specials and pieces. So if you are looking for a platform for your meetings and or webinars and pieces that you're doing, contact PowerNet. You can find them at the EOCC website. Also, I want to recognize our East Orlando Chamber trustees, and those include AdventHealth, Avalon Park Group, Avalon Insurance Services, Duke Energy, Fairwinds Credit Union, Greater Florida Insurance of Hunters Creek, the Orlando Law Group, Orlando Health, and the Suburban Land Reserve. So we appreciate all of the benefits and value you bring to us and to as stakeholders in our community, and also leaders within the chamber. With that. So we like to give them due recognition for those. So without further ado, I want to go ahead and introduce and bring on Dr. Syed with AdventHealth. And if you have any questions, Doctor, if you want to answer those as we go, or do you want to do a Q&A afterwards?
Yeah, I think I can answer as we go, and then in the end, we can always do the Q&A.
Okay, what we'll do is if you have a chat just so that he goes through, please go ahead and chat, type your questions in the chat if there's something that's there that's pressing with the topic that he's on. We can put it in the chat box, so if you see it there, Doctor, you can answer it from there. If you need to, I can chime in and I'll monitor it also from my end. So
okay,
without further ado, thank you for being here today. We really appreciate it. And let's learn how we can reduce some of this stress and manage it the best way possible in a COVID environment.
So, hello, good afternoon. So thanks for inviting me for this very important topic about stress management, especially during this time when we are so much, there's so many things happening. And first I will talk about the stress symptoms, and then the management in the end. So next slide. Okay, so I think we'll go with the presentation. Let's see. So stress, definition of stress is it's the normal reaction the body has when changes occur. It can respond to these changes physically, mentally, or emotionally. Historically, stress was our friend. It acted as a protective mechanism that warned us of danger, a natural reaction that told us when to run. This response is now referred to as the fight or flight response. When we use stress at the right time, stress increases our awareness and improve our physical performance in a short burst. But when stress continues, then it becomes a big problem. There was a study conducted in 2018. In this study, they found out that 75% of Americans say they experience extreme stress at least one day a week on average. So I'm talking about this study which was done in 2018. So imagine how much more stress an average person have at this time with COVID-19, financial calamity, and rest of the social changes happening in our community. Stress is such a serious and common problem that I will say it's an understatement to suggest that we have a stress epidemic. The biggest stress at this time is due to the COVID-19. I think next slide. Stress due to COVID-19. So there are different factors which contribute to the COVID-19 stress. I think one of the factors is working from home. Workplace burnout doesn't just happen to people who put in long hours at the office. It's also a threat to the millions of people working from home due to the pandemic. Burnout happens when you face elevated level of stress over a long period of time. It can affect both your mental and physical health. Suddenly, so in the last 3 months, so many workers suddenly working from home, and they have to juggle multiple responsibilities. They could be more prone to burnout. The causative factors, one of the big causative factors are disappearing boundaries between work and home. Leaving your workplace and commuting back and forth from home to work is a forced boundary we create between work and home. Now these boundaries are blurred. A person may also feel lack of control over his schedule while working from home. Time management is difficult to manage. I have so many patients, they feel that they're pulling extended hours in a work as they're working from home. And some people have enough place they don't have enough place in home to work. Sometimes they feel like they're pulled in the different directions at home also. Social isolation is, I think this topic is beyond introduction. Social isolation is kind of understandable that during this time, people may experience increased anxiety, stress, as they limit social interactions, spend long stretches of time at home. In general, humans are a social creature, we value our relationships with other people. So in times of stress, our instinct is often to reach out to others in our social group to help ourselves feel better, whether that is to be comforted by a friend or a loved one, or to do the same to other friend or loved one. For other people, when we cannot do this, we may feel helpless, lonely, and this may interfere with our ability to cope effectively with the stress. And as you all already know, that COVID-19 is spread through person-to-person contact. Our normal avenues for social interaction in the physical world have changed and need to be conducted virtually. Everything needs to be conducted virtually. So this may feel less effective and less soothing than connecting in person, because we are not used to it as our primary form of connection. Sometimes it can lead to boredom, frustration, sometimes anger. So, 50% of our communication is through body language. You don't have to say anything, and then we can communicate through our facial expression, our hand gestures. And to be honest, it's very difficult to do it virtually. Socioeconomic setbacks, probably you guys know more about this economic setbacks than others. There's so many people who lost their job, business have reduced hours. There's a tremendous amount of stress in the business community. Decrease in recreational activities. COVID has significantly reduced our outdoor as well as indoor activities, from going to sports events, to dining at your favorite restaurant, from going to theme park with family, to going to bowling with friends. Of course, these activities help us relax and give us a break from other stressful aspects of life. And these outlets are not available, or if they're available in the limited way. Increased difficulty in keeping work-life balance. As I mentioned, boundaries are blurred between work and home, and it's difficult to separate them out now. Uncertain future. During this stressful time, many people are concerned about the future. They have questions about when things will be normal, how will it be? And nobody knows, if your family, anyone can be infected by the COVID-19, and nobody knows how long this COVID-19 will last and what will happen to the economy in the future. So all these fears, it's contribute to the stress. So next slide. So, we already know about the financial cost of stress, but it's staggering. These are the data which was before COVID-19. So it's estimated that stress costs American business $300 billion a year in missed work, employee turnover, reduced productivity in healthcare costs. And there 40% of job turnover is due to the stress. So these data are before the COVID-19, so probably it will be much more. The next slide. So stress symptoms, I divide the stress symptoms into physical symptoms and emotional symptoms. Physical symptoms, you know, everybody is different. So we react differently to stressful situation. If the stress is unmanageable, it manifests itself in the different forms. And so there are different variety of the physical symptoms. Changes in sleep pattern is such a big thing. The stress can cause increase or decrease in sleep. Most of the people have hard time in falling asleep due to stress. And even they sleep, they feel like it's not restorative sleep. It does not restore their energy and they feel tired in the daytime. Tossing and turning throughout the night is the concern with the stress. And you know, in the daytime, because if you don't have a good night's sleep, you feel tired and fatigued, and it's contribute to the stress also. Changes in the eating pattern. On average, in my practice, I've seen people gain so much weight. You know, we filled up our pantry because of the fear of, you know, we are not going to have enough food, and no, these pantries has to be consumed. So it's contributing to that stress. It's contributing to weight gain. And some people, they use food as a coping mechanism. They do stress eating. There was a study done for the stress hormone cortisol. It contributes both to the accumulation of abdominal fat and enlargement of fat cells. Some people actually lose weight with the stress, with upset stomach. But remember that when you lose weight with the stress, you are not losing fat, you're losing protein, basically, the muscle mass. Fatigue. With the stress, people feel like on edge. They have muscle tension. They feel like your body is aching. So constant muscle tension leads to fatigue and malaise. Chronic stress is associated with cardiovascular disease, tension headaches, and migraine headaches. I can tell you I have so many patients if they have pre-existing issues with the arrhythmia, the stress makes their arrhythmia worse. Chronic stress can place pressure on and cause damage to the arteries and organs. I think there are theories that it occurs due to the inflammation in our bodies caused by the inflammatory chemical, which is cytokines. And on average, stress affects the longevity. I don't know anyone who is 90-year-old and in good physical shape, and they mention that, you know, they have no history, they have manageable stress in their life. Usually stress definitely affects the longevity. As I mentioned, with the chronic stress, with the cardiovascular issues, a lot of people complain that they have constant palpitation, and some people, with the increased stress, they end up having like a panic attack-like symptoms with palpitation, chest pain, shortness of breath, aches and pain. So stress generally causes low tolerance for the pain. And for example, if you have a chronic pain, it can make it worsen. Like backache and arthritis, it can make it much, much worse. And a lot of people end up taking too much pain medication, which is not the best solution either. Loss of libido, and definitely affects the relationship, especially during the COVID-19 time, when people are cooped home. Worsening of chronic health problem, Stress affects every part of the body in a variety of ways. I have seen people with the diabetes, with uncontrolled blood glucose control, and there is a science behind it. Cortisol, stress hormone, increases the hyperglycemia. And there are numerous examples of stress worsening the health situation. Correlations have been found between stress and the top 6 causes of death: cancer, lung ailments. Cancer, as I mentioned, inflammatory cytokines release the free radicals. Lung ailments, heart disease, liver cirrhosis due to the increased alcohol use, accidents, suicide, and I will say motor vehicle accident because of the lack of concentration secondary to stress. Weight gain, weight loss. I think we already touched this topic also. Let's move to the next slide. Gastrointestinal symptoms like stomach pain, diarrhea, constipation, heartburn, and gastritis. Gastrointestinal symptoms in stomach is closely connected with our nervous system. So people say you have a nervous system in the brain, and then you have a nervous system in your guts. So anytime if there is increase in stress, it releases the gastrin, which causes gastritis. Stomach ulcer, very common for severe stress. Some people have like irritable bowel syndrome. It make it worse with nervous diarrhea, alternating with the constipation. Some people, with the stress, they complain about the persistent nausea, and they try all kind of medication, nothing helps. And this is called like functional dyspepsia. And if you release the stress, they're off their proton pump inhibitor medication. So overall, this with the GI symptoms related to stress, you end up using a lot of medication, which can be easily managed with releasing the stress. Teeth grinding, especially in nighttime with the stress, is very, very common. Sweaty hands or feet. I will put it as the part of like a elevated anxiety or panic attack. So the mechanism how these physical symptoms work is there's increased secretion of cortisol, adrenaline, and inflammatory cytokines, which I described before, and it causes the fight or flight response. Acute and chronic stress have been associated with immune system suppression, and especially with COVID-19 coronavirus, people who are in extreme stress, they're more susceptible, they're more vulnerable to have infection. That's a very important thing to remember. Okay, so next symptoms, we'll go to the emotional symptoms part. First symptoms of emotional symptoms is irritability and agitation. A lot of family members complain that their loved one, they're working together in the home or in the workplace. They feel like, person is very irritable. Low frustration tolerance is very common with people with stress. Co-workers complain. They feel like they're walking on eggshell around this person. It affects the relationship between family members and co-workers and decreases the productivity in general. In order to be productive at work, you need to work together, and it definitely affects it. Road rage is very common. Probably you have seen it all especially in the I-4. Sadness, depression. First of all, I would like to tell you about the sadness. Sadness is a common reaction. It's a normal feeling. Most of us feel sad at times, but if it becomes constant and debilitating, and if it affects our functioning both socially, occupationally, then it becomes a big problem. It becomes depression. At that time, when it reaches to the depression level, it's a good idea to reach to the mental health, like counseling, or to work on the stress management in a better way. Blaming some people with stress, they project or display their anger. They display their anger or frustration to others. In a sense, it's a defense mechanism, or it's a negative defense mechanism. which affects the relationship and productivity. Apathy, lack of feelings, indifference. Sometimes stress makes people feel emotionally numb because they're feeling so stressed. They hide all the emotions inside. They bottle up all the emotions, and if you don't communicate, you keep it to yourself. It causes more physical manifestations and psychological manifestation also. Lack of concentration is one of the big, sometimes the first symptoms of the stress. Concentrating on the work, when they're concentrating on the work, people feel distracted. It's hard to finish the work on time. It causes procrastination, unfinished work. Sometimes the little task becomes such a bigger task that you feel like you spend like hours and hours extra just to finish the simple task. So overall, it affects the productivity. Some people with the stress, they startle easily. They feel on guard all the time. They're restless. They're jittery. They're on edge. Sometimes nightmares or recurrent thoughts about the traumatic situation in some cases. For example, if you have a motor vehicle accident in the past, or if you have a trauma, abuse in the past, with the stress, you can relive the same experience again and again. People have problem with the nightmares. They feel like they're reliving the same experience. I think next slide. Isolation or disconnection from others. As we have seen with the COVID-19, there's less social connection and makes people feel like isolated. They feel like there's no channel of communication. They feel they're the only one who are suffering. Poor self-care, hygiene, lack of motivation. Generally speaking, if you're working from home, you don't take care. You don't want to like change into the different, like your work clothes. You just want to take it easy. But sometimes it leads to the more like lack self-care. Poor self-care, and people feel lack of motivation. They stop caring about themselves, especially self-grooming, and it affects their appearance, and sometimes it contributes to the stress. And sometimes people, they love to do things before and they stop enjoying this thing also. As I mentioned, persistent stress causes muscle tension, poor sleep, people feel exhausted all the time. Feeling of failure and hopelessness. Sometimes stress makes you feel you're stuck in the vicious cycle and there is no way to get out of this vicious cycle. So then it develops the cycle of hopelessness. People feel that they cannot do things easily. They lost confidence in their abilities to do better job. Excessive worry or fear about something bad happening. People with stress, they feel that they cannot stop these worries. It's just like a train, just keep coming. And they fear about the future, and they feel like, I think it goes to the hopelessness feeling. Sometimes people feel that the other's trauma is their own. If you're watching news nonstop, sometimes you feel guilty about, surviving or doing better than others. Sometimes people over empathize. I think there should be a balance between over empathize and feeling guilty and feeling, sympathy for other people. Tobacco and alcohol overuse. In my practice, I have seen a dramatic increase in the consumption of increased alcohol, which reached to sometime at the like toxic level. Sometimes people use alcohol to self-medicate themselves for stress. And alcohol, as you know, the excessive use of alcohol is a depressant. So it makes people feel more stressed in the long run. Some people, they use the marijuana to deal with the stress, and it makes things worse in the long run. Excessive use of tobacco is very, very common. Next slide. So I want to show you this stress curve. You can see in the diagram that performance has been affected by the stress level. So a little bit of stress is important to perform optimally, right? But you can see if the stress reaching to the level of the burnout, then it can decrease the performance dramatically. So this is a stress curve which is which applied to every kind of stress, basically. So I think we can move to the stress management, and that's the purpose of the whole presentation, how to manage the stress. I will start by saying that, I tell every one of my patients is that your biggest asset is your physical and emotional health. That's simple. That's a simple statement, right? And it's important to remember that some anxiety and stress is useful, especially in a situation where we are in the immediate danger. It can remove us from harm and it motivates us to act. So I'm not saying that you should not have any stress. You should have a little bit of stress to keep going on. However, when anxiety impairs our ability to function, both socially, occupationally, then it's important to manage it in a healthier way. And then you have to understand the difference between the stress versus burnout. While stress is our response, burnout is the accumulation of excessive stress over time, which results in unmanageable stress level. So basically, again, I want to re-emphasize that we are not aiming towards being stress-free all the time. That's unrealistic. I think we need to focus on how to manage stress in a positive way. So,
Dr. Syed, have you been seeing increased cases, or I know it may be, stress can be a long-term thing, but in the last 3 or 4 months, have you seen more people come forward or cases being addressed of stress or being diagnosed with high stress and things within the system?
I can say that nationally there is a 30% increase in the consumption of prescription of benzodiazepine like Xanax, Klonopin, nationally. It helps with the stress, but in our practice, we have seen a 60% increase in referral for anxiety, feeling like, having nervous breakdown. I just saw a guy last week and he managed, exhibition team. It's part of affiliated with the, National Sports League. Mm-hmm. And he feel like he's stuck in the vicious cycle. He feel like he cannot manage. He has no prior psychiatric history. Very well-to-do guy, everything was going wonderful for him, but at this time he feel like there's no light at the end of tunnel. So what happened that I saw him about a month ago, and we managed him well with the stress reduction, with the therapy, with medication a little bit. And I spoke with him last week. He said that because of the stress, he feel like he's stuck in the vicious cycle. His decision making ability was pretty much impaired. So when the stress release happened, he was able to find the investor who was willing to invest in his organization. So he has so many different ideas that he was stress free, because the stress is impair your ability to think thoroughly and come up with the plan. Does it make sense?
Yeah. So when somebody is diagnosed with high stress, and there's a lot of complications that can start with that, and cause health related issues and things. But can people overcome that? And I mean, is it through therapy and doing a bunch of the different stress management things to actually get through it, or is it half mental, like when somebody's like unemployed and they're really stressed because now but then when they get a job, and then does that seem to go away? Like the stress, I don't want to sound ignorant, but I'm just saying, is stress
So
have different?
basically, there are people who are always vulnerable. They always have some little bit anxiety as a baseline, and with the stress, it makes him unmanageable, right? So these people need a little bit help with the mental health. Some people, as I mentioned, stress is our way to cope with the situation. It gives us more motivation. It gives you more ideas. But when stress reaches to the level when it affects your functioning, like like this guy I just mentioned, he was not thinking clearly, right? He was a brilliant guy, he was a smart guy, but because of stress, he was not thinking clearly. So when it affects your functioning, then it's a good idea to get some help, like stress management help. I can when we go through our presentation, I can talk about different stress management skills.
Mm-hmm.
And these skills are for people who have no prior history, and they can manage just using these skills. Does it make sense?
Yeah. So a question popped in is there an intent to treat with medication on a temporary basis for people that have stress for coping and things like that? Are they doing, or are there other techniques that you recommend
basically,
first?
I strongly recommend the stress management with the techniques which I'm going to discuss in the presentation. But once you use this technique and you use it for like a couple of weeks and still not working, then probably it's a good idea to seek some professional help. As I mentioned, there are some people who always have a vulnerability. They have a pre-existing little bit stress always there. They have some anxiety, they have depression. So these people, probably it's a good idea, if they're stressed, that they should seek mental health care. But majority of the people, this stress goes away if they use the stress management skills, and they don't need to seek any professional help. And for example, if they use medication, they are not going to use medication for long-term use. There's a diagnosis called adjustment disorder. Adjustment disorder diagnosis means that you have some stress which is causing some impairment in functioning, but this functioning impairment is supposed to last only for 3 months. More than 3 months, if it continues for more than 3 months, probably it is categorized as like depression, anxiety, and other things. So, with the medication management, it should be temporary. It should be, we should aim for like a short-term use of the medication. Especially the benzodiazepine, it has highly addiction properties. It should not be used on a regular basis. It should be used sporadically. And once the stress is released, for example, getting the job or learning the better coping skills, you have to wean yourself off these medication. I prescribe medication, but I totally believe in the counseling and stress management through the mindfulness.
So are there pieces, like when you treat a patient, that you help them with the stress management part? Because sometimes, like you said, you had a patient that he wasn't thinking clearly and he was brilliant and everything else, and sometimes you get to a point where just nothing, you can't even focus. So what do you recommend with that? Like, I'm looking at the stress management slide here with the different things you can do.
I think the best thing, I can go one by one, each coping skills, and then I can explain it in detail. So the first thing, I think we already talked about that. And the second thing, I will say that it takes work to manage stress and build resilience. Like everything in life, changes does not happen automatically. You have to work on it. Consistent practice is the key, not achieving perfection. Those people who invested a lot on their stress management, they have a better outcome in the long run. So stay close to your normal routine is one of the biggest thing. Probably heard it all the time. This is a very important point. We need to try and maintain some semblance of structure from the pre-quarantine days, and we need to make sure that if you have kids, Sticking to the routine might be easier as you work from home. It could be tempting to fall into a more lethargic lifestyle, which could lead to negative thinking. So I strongly recommend people to wake up at the same time, going to bed at the same time, eating meal at the same time, taking a shower regularly, continuing with the exercise regimen. For example, you do laundries on Sunday, not to change it. Sticking to the normal routine keep you active and less likely to spiral. It will be easier to readjust to the outside world when it's time to go back to work. Right now, I think quarantine, we are moving to the less lockdown, more open stage right now. But still, it's very difficult to spend time because most of the things are closed. So why not do something special during this quarantine days and subsequent reopening phase? For example, you can start a daily journal to jot down your thoughts and feeling to reflect on later, or maybe start a ritual of taking a walk every day at around like 7 p.m. when it's not very hot. Try to connect with the friends or FaceTime every morning or other time. Start some new project, watercolor painting, or any project at home. I think these kind of things, special things during this time, will help you look forward to each new day. I can tell you about myself. I recently got the puppy dog, and it's a lot of work initially, but it helps a lot to relieve the stress. Having any kind of pet helps release the stress. Creating healthy boundaries are essential for our stress-free life. When we have boundaries, healthy boundaries, we respect ourselves and take care of our well-being by clearly expressing our boundaries to others. When we express our boundaries gently, but sometimes we have to do it firmly, but in the long run, it helps improve the relationship and help improve the productivity. I'm a big fan of affirmation and imagery. The power of positive imagery and affirmation is now scientifically proven to increase positive emotions. When you think of the positive experience, your brain perceives it as a reality. So try to replace these negative thoughts with positive statements and challenge and change the way you see and experience the world. Self-talk helps a lot, and reassuring yourself helps relieve the stress. It helps motivate you, and repeating this positive statement helps with the self-belief. Sometimes, visual imagery, you can imagine yourself in the best relaxing place you ever have been. And when you're stressed, you can just paint this picture on your brain that you're in this place. Sometimes, in my office, there's a picture of the very nice, beach. I imagine myself in the beach, not very hot weather, but just a normal weather, and then it gives me a little bit release from the stress. Everybody is different. You have to cultivate ways to be more calm. And you have to understand that it's okay to feel a little bit anxious. And then other point is be assertive. Sometimes we keep our emotions to ourselves and we don't have a clear and effective communication. I will say clear and effective communication is the key to being assertive. When we are assertive, we ask for what we want or need, and also explain what is bothering us. So when there is an effective and clear communication, you have to do it in the fair and firm manner so that you can have empathy for others. But once you identify what you need to communicate, you can stand up for yourself and be proactive. And the next point is try to eat healthy, well-balanced meal. I think you have any question for me in the between?
Yeah, we've got a couple more. Okay. There were two that jumped in. One was, what do you recommend looking for signs of stress or anxiety in children? So that was one of the first questions there, if you want to answer that one.
I can tell you the stress, I have 2 kids also. It's very boring. There's nothing to do, to be honest, except video games. So stress is like, persistent, I see children also. I see adults and children also. I have seen that people feel more, kids feel more bored, and they have more irritability, they have low frustration tolerance, they're more defiant, they're argumentative. Sometimes they're social isolating themselves. They have very strange kind of sleep pattern. They stay late. They watch YouTube or other things all night long. They're getting so much information from the social media, which is adding on their stress. The problem is that in social media, everybody can put their 2 cents there, right? Even if it's right or it's not wrong. So we have so much information that is difficult to handle. If we have difficulty in handling these emotions, this information, imagine how the children will have. They have tremendous difficulty with dealing with the first COVID-19, not socializing, not seeing their friends, not meeting their friends, not going to the amusement park, not going to the fun things. It's tough. What I do with my children, I divide their time in 3 different segments. One segment is to have fun. They can play video games, they can chat with their friends, or they can watch movie with us, and then I go for a walk. I go with them on the bicycle trail. Then second part is exercise, as I mentioned, like bicycling trail. Then I have elliptical. They use elliptical for half an hour every day. And the third part is like, getting yourself more informed or educational part. So they downloaded the Duolingo. Duolingo is the app. They're learning new language. They're learning Spanish every day, like half an hour Spanish. We ordered a lot of books from the library. I think these kind of things you have to go extra mile to help them with the stress, because otherwise it's a natural reaction to be stressed and be more argumentative, right?
Yeah. I think there was a reply back that it said they block YouTube and control screen time, but they're doing a lot of Lego and board games and outdoor time. So
these are wonderful. I can tell you this is very effective. To be honest, as we are going extra length to deal with the stress, we have to help our children to deal with the stress. And sometimes they're not very good communicators. So you have to ask them, you have to reassure them that things will be better. It's not going to be like this forever.
Yeah. We have another one from Victor.
Okay.
Just I wanted to hit the questions as they popped in. Victor, if I'm going to read the question, you had a part here you chapped in before, normal or new normal, which I think you were referring to back a little bit before with the changes that are happening. But being one that is staying in having risk factors, I'm feeling like Groundhog's Day. There's only so many things that can change a routine, or when you're stuck in the house. Any suggestions for like it's the same routine. How can you break the routine, break the monotony, and when you can't get out and about? And
there's only so many days you can do laundry.
That's absolutely true. But there are other things also. Here's the thing. At home, you can, if you're stuck at home, you can always start the new project. If you can't do anything, like I mentioned, I'm learning Duolingo with the new Spanish language. It's a free app, right? I rarely used the bicycle before. Now I'm bicycling also, right? I have a group of friends. We get together in the through the Zoom, and we read one book, and we talk about this book sometime. So these kind of things, you can always, one size fits all doesn't matter. Everyone has different techniques, right, to keep themselves busy. You have to find something to keep yourself, you have to spend some time outside, but make sure that you will continue to do the social distancing, but at the same time try to find something for increased walking, or if you have a dog or something, maybe take dog for a walk a little bit more. So there are so many things. I think on the slide I will talk about other things also. Is that okay?
Yeah.
So, other thing is to get adequate sleep, and quality sleep is so important. Sleep is the cornerstone of the good mental health. Getting a good night's sleep is a fundamental for recharging and dealing with the stressful situation in the best possible way. To be honest, it varies from person to person. I sleep only 7 hours. Some people feel 8 hours. You have to recharge your batteries. So establish a routine by going to bed at the same time, waking up at the same time. Avoid too much screen time, too much caffeine. Before bedtime is important. If you're unable to sleep, I usually recommend to people to get up, to get a glass of water, walk around instead of laying for hours awake in bed. This helps avoiding the, associating sleep with the bed. If a sleep problem persists, then consider natural supplements. I usually prefer melatonin or chamomile tea. Exercise at home or while maintaining social distancing outside. I always tell people to exercise purposeful and have the time schedule for the exercise. There's probably everybody knows that when you exercise, there's endorphin release. Endorphin is the hormone which decreases the stress hormone, which is the cortisol hormone. Sometimes I'm so busy that I don't have time for exercise, so I just do like 5-10 minutes in the morning, just to give it a token. When you engage in exercise and you are doing it every day, even like 5-10 minutes, it gives your body a schedule that you feel like you're still engaging with the exercise. Avoiding excessive alcohol, drug and alcohol. So as I mentioned, I've seen tremendous increase in the alcohol consumption, and this is very important to seek help if your alcohol consumption is excessive. Listen to the guided meditation before bed or early in the morning. I usually use the app. It's called Calm, CALM, or Headspace. I personally like the Headspace better because it has a voice guided meditation. It's only 10 to 15 minutes. Sometimes it's enough. Practice deep breathing exercise throughout the day. For example, inhaling for 4 seconds, holding for 4 seconds, and then exhaling for 4 seconds. I have the Apple Watch. It tells me when to breathe every 2 hours. I take a minute, 2 minutes to breathe in, hold, and breathe out. Muscle relaxation, yoga exercise. I have my wife has the virtual yoga instructor right now. She followed that person very regularly. At the same time, during the day, pause and focus on the current activity. Try to have some time to feel the sight, smells, and sensation. Like, for example, brushing teeth. Just hold on. Just try to give yourself some quietness, and then maintain a list of personal stress reducing enjoyable activities. So I have a list actually of the things which I usually do to release the stress. For me, reading a book is wonderful. Going for the stroll is wonderful. I just told you that I have a dog, puppy, so I take and play with it also. So you have to find the time to unwind. try to find the new activities. You know, personally, I'm learning new favorite like cuisine, learning new language. I already told you about that. I think the biggest thing is to limit access to too much information and news. Take a break from watching, reading, or listening to news non-stop, social media non-stop. There is a non-stop coverage of the news events. So sometimes, you know, you have to take a break. In my iPhone, I have the limitation on the screen time, YouTube and everything. So make some time for the quietness and think creatively about connecting with others. As I already mentioned, that I try to connect with my friends and family. I use a Zoom once in a while. Let's see, and then faith communities, like, you know, drawing your spiritual belief virtually is still possible. And you have to manage your time every day. You have to prioritize of the things which you can do. And as I mentioned, focus, don't hold it inside. Try to have open communication. Okay, improve your sense of control and ability to endure. We have to accept the circumstances we are in and try to make the best out of it. Try to be hopeful. Try to give the reassurance to your family and your loved one that this is just the temporary situation. Make a list of gratitude. You know, what are the best things you have right now, which you can make it better. And then again, if things get worse, there's always the, you know, there's a psychiatric help and therapist help. I think we are running out of time. Let's take the questions more. Is there any other question? If you don't have any question, we can play the video about the muscle relaxation.
Yeah, I think that might be a good one. Let's go ahead and play that. The last one I have is just a lot of outdoor games, comments to what they were doing with kids. So why don't we play the video for you?
Okay, let's do that. This video is about the muscle relaxation.
Hi, I'm Candace Alexander, Director of Health Promotions with the American Lung Association. As a health educator and yoga instructor, I'd like to share some tools to help you stay calm during times of stress. I'll share practices that enable you to cool and calm the nervous system while enhancing clarity, serenity, and deep rest. Today's session is focused on progressive muscle relaxation. So all you'll need is a chair to sit in, where your back is well supported and your feet can sit flat on the floor. You also can sit on the floor with your knees crossed or lie flat on the floor where your head and knees can be supported. So let's get started. So just taking a moment to check in with the body. That is, making sure that the shoulders are relaxed, that the arms and hands have a place to rest comfortably. And taking in a nice gentle inhalation and letting it go with a sigh. Once again, taking in slightly deeper but gentle inhalation through the nostrils and again letting it go through the mouth. Perhaps already beginning to feel a sense of softness in the body. So we'll move our attention into the body to release trapped energy and move deeper into total relaxation. Starting with the lower half of the body, in a moment, I'm going to ask you to take in an inhalation, and I want you to create some deliberate stiffness and stretching in the parts of the body that I mentioned. So again, inhaling and deliberately tightening the feet, the legs, the knees, the thighs, the buttocks, the tummy, whole lower half of the body. Hold, hold, tighten, tighten. And now let go. And on the next exhalation, letting go even more. And observe the flood of energy in the legs. And next we'll work with the upper part of the body. As you inhale, again, making it deep and hold. Tightening the fists, the arms, the shoulders, the chest, the back, the neck, the face, the head. Tighten, tighten more completely. And now let go. And on the next exhalation, letting go completely. Observing the flood of energy in your arms, and face, and head. And this time, we'll work with the entire body. Taking a longer but softer inhalation if you can. And as you hold, tightening the feet, the legs, the knees, the thighs, the buttocks, tummy, chest, back, shoulders, hands, arms, face, neck, head, whole body, tighten, tighten as long as you can, and then let go. The next exhalation, letting go. Observing the feel and flood of energy, extending to all muscles, nerves, and cells, the entire body. Just let your whole body melt into the flood of energy that you feel. Let the whole body go limp. Rest in silence. And slowly feel yourself as you deepen the breath, rising back to the surface of awareness. Awareness of the physical body, how well the chair, floor supports you. Sounds of the room, the air in the room, how it touches your face. As you feel the impulse beginning to move, perhaps stretching the body as if awakening from a restful nap. When you're ready, open your eyes. Thank you for joining us for this practice. If you'd like to know more, go to lung.org or call our lung health line. Breathe easy. Namaste.
Okay, is there any question?
Yeah, we have a couple of just some comments came in. Someone was saying that they have a lot of stress going through this time because of being alone in the house. Zoom calls not doing it. I hunger for human interaction. She has a list of projects that she's going through, but I find herself doing a lot of activity the rest on the couch. You talk about getting help. Many people are resistant because of the stigma of seeing a shrink. I'm seeing my therapist once a week now, so I know it's important for me to get this. This was somebody else. I'm sorry, I was reading. I thought it was all in one chat. I'm sorry. So there was that was one comment, and then there was somebody else here that was just saying they know how important it is. So how do I get those? I know that I know help to reach out and get help. I know
basically, the stigma is the main stigma is like when you go to the clinic, and then you have to register their physical presence in the clinic. Sometimes is a stigma, but now luckily we have virtual appointments. So I can tell you that 50% of the patients I see is virtually. So virtual appointments sometimes takes away the the inhibition, and then you can make it possible while you're still at home. So I think this is the main thing that some people think that there are two kind of people live in the world. One is crazy, one is not crazy.
Mm-hmm.
So I tell them that there is a people who have just stress. They're not crazy. They're not like hearing voices, or they feel like they're getting messages from the God, right? They have just stressed out. Stress is a normal reaction to the event, right? So I usually try to normalize this thing. It's like for example, you have a diabetes, you have increased glucose level in your body, and you need like some kind of medication to regulate it. And sometimes with the therapy, it does work like a medication, that it will control your cortisol level and adrenaline level and noradrenaline level. So I think the analogy of the other medical problem and psychiatric problem is a good one. It will make people understand that your mental health is as important as your medical health.
Yeah. Is two things just to go back to that. One, I've seen a lot of people really enjoyed this video. Is this video are you able to access this video like on YouTube or from the AdventHealth website or anything, if people wanted to use that as a daily routine or exercise?
This video has been it's been there for a very long time. There's another video on the YouTube. There's so many videos on the YouTube. This video is available on the YouTube. So if you Google like American Lung Association, they have this video about the muscle relaxation.
Okay.
And as I mentioned before, there is an app called Headspace, and there's an app called Calm, CLM. Headspace I like a lot because a guided meditation, you just do it for 5 or 10 minutes, and then it can just walk you through first thing in the morning. It helps you, feel like grounded.
And then just to go back, and I may have missed it, but excuse me, pardon me. Victor, did you get your question answered of how do you help friends? Did you get that answered in that questionnaire? I'm sorry, I was kind of...
No, for me, it's just frustrating because I've got a good grasp on my several issues and stuff, and seeing Megan, my therapist, and I had written down that AA meetings don't work online, and that I need to be, be around people in those situations. But I know a number of my neighbors and friends that are stressing out, are abused, are gone from social drinking to hard time drinking, and one in particular basically told me that he's just gonna be drunk sleeping until this thing is over and stuff, and I really want to help, but it's hard. Being an alcoholic, I know I had to take the first step, and that's what it requires, but it's hard and frustrating, and just increases my stress factor also, because being the caring kind of guy that I am.
So, for this person, for alcohol, increase using alcohol, he's self-medicating himself with alcohol. is becoming a problem for him. Like, you mentioned that he's not socially interactive. He just drinks himself to the sleep, basically. The AA meetings, I have several patients, they're doing the virtual AA meetings. And there are some AA meetings which are keeping the social distancing also. I'm not sure. I think there is one in the Rollins College. They're using the social distancing during the AA meetings.
Yeah, I know there are a number of them that are starting to do that and stuff. But as you know, as a therapist, you get so much more out of from my nonverbal communications when you ask. When Megan asks me a question and I hesitate or I look up, and she knows that we trying to think of what she wants to hear, and so that's where the virtual really doesn't come in. And with AA, it's really important to for those people to really have that contact and have that visual, and just to look eye to eye, other than through the computer, to say, "Hey, everything's going to be all right."
Absolutely. So, any other questions?
I don't see anything else popping up here. Yeah, people are just chimed in. Calm and Headspace are good. Look for the free ones. I think that's.
I think YouTube one was the free one.
There you go. The YouTube ones are free. All right. Well, I don't see any others there, and we've gone past our 3 o'clock time. So I just kind of want to finalize just a few things that we do have here. So if there's no other questions, I want to say thank you to Dr. Syed, and
no problem.
Next week is our Health Council Collaborative, which we've got a new platform that we're working on for a networking opportunity for folks, especially in the healthcare industry, where we'll be pairing folks up, and we've got some different topics that will be being addressed within the healthcare industry, but that will be coming up next Thursday, earlier in the morning with that, and that's our Healthcare Collaborative. But we do want to thank everybody. I know I've gone over. We've got plenty of webinars coming up real soon. I know Dorothy sent me a PowerPoint, and I've lost it, and she's gonna. But with that, I do want to just thank everybody for being here today. I think everybody has kind of got a little bit of that and understand that we're all going through different levels of things, and in our families and friends, and it's important to hear this and know that there is support out there, and to reach out and talk to those that you have, and as much as possible. I thought there's some great tips in the chat pieces here, so we appreciate what's there, and we're trying to do our part to get us back together at some point, but we need to make sure we're doing it safely. And now with a spike, with some of the spikes now in this COVID-19, we need to be a little extra cautious. So we just need to make sure that we weather this the best as possible and lean on each other. And, I know social interaction isn't the same as human, but hey, at least we're seeing people here through a Zoom. It's not just a call where it's not I'm looking at my blank wall while I'm listening. So we appreciate. So thank you, Dr. Syed. We really appreciate your time this afternoon, and appreciate AdventHealth for putting this together. So thank you, Murtaza.
No problem. Anytime.
And all those. So we will continue again.
Thank you, guys.
So thank you all for being here, and we will see you again real soon.